Conventional bone. Case number 7, meningioma. Localized thickening of both tables and the diplo as well as sunburst spiculations are seen. Case number 8, hemangioma. A slightly expansile lesion with marginal sclerosis and characteristic radiating bony spicules within the lesion is seen. Case number 8, fibrous dysplasia. Mixed lytic and sclerotic lesions are seen in the frontoparietal area. The disorder involves the outer table, that appears interrupted and expanded on the top of the vault, whereas the inner table remains intact in the entire skull.
Case number 8, Paget's disease. Thickening of both the outer and inner table, widening of the diplo, loss of differentiation between tables and diplo, and irregular areas of sclerosis, cotton wool appearance, are diagnostic. Case number 9, thalassemia. Widening of the diplo and thinning of the outer table with sunburst appearance and sparing of the occipital bone below the internal occipital protuberance are characteristic. Poor pneumatization of the sinuses is also associated. Case No. 11, osteoporosis. A thin sharply defined end plates with accentuation of the vertical trabeculae are seen. Osteomalacia. B. Uniformly biconcave vertebral bodies with poorly defined end plates and blurred trabeculae are seen. Case number 14, diffuse osteopenia with bowing deformities of the narrowed, overconstricted, tibia and fibula shafts with flaring of the metaphyses is seen in anteroposterior, A, and lateral, B, projections, consistent with osteogenesis imperfecta. Case number 15, X-ray chest, A, and pelvis, B. Generalized, cystic appearing osteopenia caused by red bone marrow hyperplasia, with main involvement of the central or flat bones characteristic. Note also the bulbous widening of the anterior ends of the ribs. Findings of thalassemia major. Case number 16, multiple myeloma presenting as generalized osteopenia in the spine. In this case, however, extensive destruction of L1 and the destroyed left pedicle of L5 suggest the malignant process. Case number 17, an expansile lytic lesion in the fifth metacarpal that would have an extremely long differential diagnosis. Barely discernible is subperiosteal bone resorption on the radial aspect of the middle phalanges, arrows. A second, smaller lytic lesion is seen at the proximal portion of the fourth proximal phalanx. It has a different appearance than the other lytic lesion, emphasizing how brown tumors can have almost any appearance. The multiplicity is typical for a brown tumor and limits the differential diagnosis. However, the finding of subperiosteal bone resorption makes any other diagnosis unlikely.